ship off Sydney Heads quite a while away called the Ruby Princess, and there are confirmed cases of coronavirus on board.
Landfall, Sydney Harbour, dawn on the 19th of March, one of the deadliest moments of COVID-19's arrival on Australian shores. 662 coronavirus infections and at least 21 deaths followed passengers down the Ruby Princess gangway across the country and the globe. The grim statistics are, by now, well enough known. Less understood is the flurry of flawed decision-making in the final countdown to the ship's arrival through the Heads and when it reached its berth, many of them by officers of the Australian Border Force.
If we weren't on the Ruby Princess, we wouldn't have got sick at all. I doubt that we would have got the virus.
From the outset, Border Force Commissioner Michael Outram was adamant the New South Wales Health Department alone bore responsibility for the passengers leaving the Ruby Princess.
New South Wales stated to the Ruby Princess, and I quote again, "You are free to disembark tomorrow."
It's a matter of record that New South Wales Health didn't send officials to meet the Ruby Princess dockside, having fatefully rated it a low risk. Its tearful regrets have already been painfully laid out in the Special Commission.
Myself and my colleagues at the Public Health Unit were working very hard on this. We did what we could.
But tonight, 7:30 can reveal how Border Force was also racked by confusion and miscommunication in its own ranks. The genesis of its mistakes could even be traced back to one single, poorly designed form sent from ship to shore that morning in March.
The smoking gun that it was the Australian Border Force that made the final decision for passengers to disembark the Ruby Princess.
As the Ruby Princess steamed towards Sydney, the ship began reporting a rising tally of sick. On March 16, 3 days from Sydney, 53 were reported ill, 10 with temperatures, 8 with other complaints. Just 2 days later, the number of sick had more than doubled. 128 were ill, 24 with a temperature. 13 passengers were in isolation by trip's end. 2 would be evacuated by ambulance on arrival, later found to have coronavirus. Right from the beginning, there was confusion about what sort of tests had been done on the isolated passengers. One Border Force officer said they'd been told by crew staff the passengers had been tested for flu, while another heard the tests were for COVID. A rumour circulated among officials that some passengers had been tested for COVID in New Zealand, but that was a red herring about a different boat, the Golden Princess.
It was pretty expensive to go down and see the doctor on the ship. I had a bit of a temperature a couple of times, but no, I didn't go because I thought, well, I'm not going to pay $50, $60, $70 or $100, whatever it might be. So we never got tested, no.
On board the ship, the senior Border Force officer said the 11 in isolation needed to stay in their cabins while the rest of the passengers were processed. A crew member asked if the vessel had clearance to disembark. The senior officer replied, yes. The federal government concedes there was no formal approval for disembarkation, known as pratique, before passengers started walking off the boat around 6:30 a.m. But because officers had allowed passengers to leave, pratique had been practically granted.
3,000 people got off that ship into the public and just passed it around everywhere. No, we should not have been allowed off.
Yes, we should have stayed on board.
About 2 hours later, cruise ship staff told the senior officer test results for the isolated passengers had come back negative. He received an email from the cruise operator with a lab form attached from the ship's medic, Dr. Ilse von Watzdorf. At the top, under tests required, the doctor had requested tests for COVID-19. Below was a list of the isolated patients with their results to a common flu test recorded as negative. The officer told superiors all tests returned back negative. Sometime around 10 o'clock, the isolated passengers were off the boat. The Commonwealth has conceded to the inquiry the officer had misinterpreted this key document. Perhaps it's understandable he had no medical training and no backup from New South Wales Health. But the ship's medic told the inquiry she was puzzled passengers left the ship before COVID test results were known. By lunchtime on March 19, state health officials were starting to doubt their initial low-risk assessment of the Ruby Princess, which of course was too late.
We were told when you get off, you go home and you isolate. That is all that we were told, to isolate.
The upper echelons of Border Force weren't made aware of the mistake until the next day. 7:30 has obtained an email exchange that appears to reveal the very moment the penny dropped. By 3:30 p.m, the day after the Ruby docked, Border Force Commander Danielle Yiannopoulos was asking questions about the testing. So they all tested negative and now some are positive, she inquired. The inspector responded there was confusion in the test results.
Confusion? How so? It says negative.
Negative to the flu.
These documents show quite tragically that the Australian Border Force made a serious mistake when they mistook flu tests for COVID tests. What these documents show is that the Australian Border Force made the decision for passengers to disembark the Ruby Princess.
Back in March, when the Border Force Commissioner was defending his officers' conduct, Michael Outram indicated processing of cruise ships was to change.
The difference is that my officers will now say to the master, to be absolutely certain, has anyone on the ship got or had flu-like symptoms?
The failure of New South Wales Health to attend the Ruby Princess set in train a series of disastrous mistakes. Border Force told 7:30 it only has legislative responsibility to clear vessels and passengers, and that no ABF officer had authority to make biosecurity decisions on the Ruby Princess. But when the Special Commission delivers its findings in a fortnight's time, Border Force will undoubtedly have to answer for its blunders.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.